Today's topic is panic attacks and panic disorder. A panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger. It can be very scary. Many people have just one or two panic attacks in their lifetimes, and the problem goes away. But if you've had recurrent, unexpected panic attacks and spent long periods in constant fear of another attack, you may have a condition called panic disorder. Panic attacks themselves aren't life-threatening, but they can be frightening and significantly affect your quality of life. Treatment can be very effective. Panic attacks begin suddenly and without warning. They can strike at any time, when you're driving a car, at the mall, sound asleep, or in the middle of a business meeting. You may have occasional panic attacks. Panic attacks have many variations, but symptoms usually peak within minutes. You may feel fatigued and worn out after a panic attack subsides. Panic attacks include some of these signs or symptoms: sense of impending doom or danger, fear of loss of control or death, rapid pounding heart rate, sweating, trembling or shaking, shortness of breath or tightness in your throat, chills, hot flashes, nausea, abnormal cramping, chest pain, headache, dizziness, lightheadedness or faintness, numbness or tingling sensation, feeling of unreality or detachment. One of the worst things about panic attacks is the intense fear that you'll have another one. You may fear having panic attacks so much that you avoid certain situations where they may occur. If you have panic attack symptoms, seek medical help as soon as possible. Panic attacks are not dangerous, but they are uncomfortable. Panic attacks are hard to manage on your own, and they may get worse without treatment. Symptoms can also resemble the serious health problems, such as heart attack, so it's important to get evaluated by your primary care provider if you aren't sure what's causing your symptoms. There is no evidence of what's causing panic attacks or panic disorder, but these factors may play a role. Genetics, major stress, temperament that is more sensitive to stress or prone to negative emotions, certain changes in the way parts of your brain function. As we said before, panic attacks may happen suddenly and without warning, but this happens at first. Over time, they're usually triggered by certain situations. Some research suggests that your body's natural fight or flight response to danger is involved in panic attacks. For example, if a grizzly bear comes after you, your body would react instinctively. Your heart rate and breathing would speed up as your body prepared for a life-threatening situation. Many of the same reactions occur in a panic attack, but it's unknown why a panic attack occurs when there is no obvious danger present. Symptoms of panic disorder often start in the late teens or early adulthood. It happens more in women than men. Factors that may increase the risk of developing panic attacks or panic disorder include family history of panic attacks or panic disorder, major life stress such as the death or serious illness of a loved one, a traumatic event such as sexual assault or serious accident, major changes in your life such as a divorce or the addition of a baby, smoking or excessive caffeine intake, history of childhood physical or sexual abuse. Panic attacks and panic disorder can affect almost every area of your life. You may be so afraid of having more panic attacks that you live in a constant state of fear, ruining your quality of life. Complications include development of specific phobias such as fear of driving or leaving your home, frequent medical care for health concerns and other medical conditions, avoidance of social situations, problems at work or school, depression, anxiety disorders, and other psychiatric disorders, increased risk of suicide or suicidal thoughts, alcohol or other substance misuse, financial problems. For some people, panic disorder may include agoraphobia, avoiding places or situations that cause you anxiety because you fear being unable to escape or get help if you have a panic attack. Or you may become reliant on others to be with you in order to leave your home. There is no sure way to prevent panic attacks or panic disorder, but these recommendations may help. Get treatment for panic attacks as soon as possible to help stop them from getting worse or becoming more frequent. Stick with your treatment plan to help prevent relapses or worsening of panic attack symptoms. Get regular physical activity, which may also play a role in protecting against anxiety. Your primary healthcare provider will determine whether you have panic attacks or panic disorder or not, or any other disease that resembles panic attacks, such as heart or thyroid problems. To help pinpoint a diagnosis, you may have a complete physical exam, blood test to check your thyroid and other possible conditions, and tests on your heart, such as an electrocardiogram, ECG or EKG, a psychological evaluation to talk about your symptoms, fears or concerns, stressful situations, relationship problems, situations you may be avoiding, and family history. You may fill out a psychological self-assessment or questionnaire. You will also be asked about alcohol or other substance use. And I sent a questionnaire for the panic disorder. You may fill it up and get a full mark. Not everyone who has panic attacks has panic disorder. For a diagnosis of panic disorder, the DSM-5 may be used and will list these points. You have frequent unexpected panic attacks. At least one of your attacks has been followed by 1 month or more of an ongoing worry about having another attack. Continued fear of the consequences of an attack, such as losing control, having a heart attack, or going crazy, or significant changes in your behavior, such as avoiding situations that you think may trigger a panic attack. Your panic attacks aren't caused by drugs or other substance use, a medical condition, or another mental health condition, such as social phobia or obsessive-compulsive disorder. You can still benefit from treatment whether you have reached panic disorder or not, or are still in panic attacks. Without treatment, panic attacks can get worse and develop into panic disorder, sometimes phobias. Treatment can help you get away from panic attacks. It can reduce the intensity and frequency of them and improve your function in daily life. The main types of treatment are psychotherapy and medications. Psychotherapy, or talk therapy in other words, this is considered the first choice treatment before taking the second option, which is medications. It can help you understand panic attacks and panic disorder and learn how to cope with them. Uh, there is a cognitive behavioral therapy, which we talked about in many topics. It can help you learn through your own experience that panic symptoms are not dangerous. After therapy, the panics have no longer feel threatening. Successful treatment can also help you overcome fears of situations that you've avoided because of panic attacks. Results from treatment can take time and effort. You may start to see panic attack symptoms reduce within several weeks and decrease significantly or go away within several months. Second type of treatment is medications. Medication can also reduce symptoms associated with panic attacks as well as depression if that's an issue for you. Several types of medications have been shown to be effective in managing symptoms of panic attacks, including selective serotonin reuptake inhibitors, SSRIs, generally safe with a low risk of serious side effects. They are the first recommendation of medications to treat panic attacks, and they are approved by the FDA. There is the serotonin and norepinephrine reuptake inhibitors, SNRIs. These medications are another class of antidepressants. They are also FDA approved for the treatment of panic disorder. Benzodiazepines, these sedatives are control nervous system depressants. It is also approved by the FDA for the treatment of panic disorder. Benzodiazepines are generally used only on a short-term basis because they can be habit-forming, causing mental or physical dependence. These medications are not good choice if you've had problems with alcohol or drug use. They can also interact with other drugs, causing dangerous side effects. If one medication doesn't work well for you, your doctor may recommend switching to another or combining certain medications to boost effectiveness. It can take several weeks after first starting a medication to notice an improvement in symptoms. All medications have a risk of side effects, and some may not be recommended in certain situations such as pregnancy. These self-care steps can help you manage symptoms. Stick to your treatment plan. Facing your fears can be difficult, but treatment can help you feel like you're not a hostage in your own home. Join a support group. Joining a group for people with panic attacks or anxiety disorders can connect you with others facing the same problems. Avoid caffeine, alcohol, smoking, and recreational drugs. All of these can trigger or worsen panic disorder. Practice stress management and relaxation techniques, for example, yoga, deep breathing, and progressive muscle relaxation. Tensing one muscle at a time and then completely releasing the tension until every muscle in the body is relaxed also may be helpful. Get physically active. Aerobic activity may have a calming effect on your mood. Get sufficient sleep. Get enough sleep on that you don't feel drowsy during the day. Some dietary supplements have been studied as a treatment for panic disorder. Herbal products and dietary supplements aren't monitored by the FDA. You can't always be certain of what you're getting and whether it's safe or not. Before trying herbal remedies or dietary supplements, talk to your doctor. Some of the products can interfere with prescription medications or cause dangerous interactions. Here's the end of the presentation. Thanks for your attention.